Katrina was a Category 5 storm that struck the Gulf Coast on August 29th in 2005. It hit Louisiana, Mississippi, Alabama, as well as parts of Florida. There was massive flooding that occurred. We're focusing mainly on New Orleans. That was the area that was struck the hardest. And what really caused the most damage was that the levee system broke, and so that caused flooding that eventually covered 80% of New Orleans. And it was named by FEMA the single most catastrophic natural disaster in U.S. history. So there were 1,833 deaths. The majority were caused by drowning, and then 25% by injury, 11% by heart conditions. And we found that nearly half of all the deaths in Louisiana were from people 74 and older. This Hurricane Katrina caused $108 billion in damage, and up to 600,000 households were displaced even a month after the hurricane. Again, the flooding and widespread damage from Katrina delayed rescue, and so that was part of the reason that I don't know. Yeah, there were so many casualties, and the government was criticized a lot for their response efforts, and they said that they weren't doing what they should have been doing, and they weren't prepared. And actually, I thought this was interesting. Over $800 million were given to disaster relief, but only $40 million was used for reconstruction and to help the victims of Hurricane Katrina. So it was a big, big issue. And then the majority of the federal aid went to emergency relief operations. Initially, the Coast Guard rescued a bunch of people, and then the American Red Cross came in. A big part of the relief efforts was geared towards providing shelter because of all the people that were displaced from the flooding. And again, the direct relief, over $47 million went to medical aid, and $4.6 million cash grants. FEMA, who was also criticized, but they also donated a lot of money to provide relief in the Gulf states to repair the roads, schools, buildings, and that was all within 10 years following the storm as well.
Alright, so demographics in New Orleans looks like majority is female at 53%, and then 47 is male. The majority of the people are ages 20 to 54, and each group or category is about 14% of each. High school education, about 85% of people in New Orleans attend high school, 35% then go on to do college, and the dropout rate is pretty low, about 15%. And the most common study thing in college was the science and engineering. And second, the biggest causes of death each year is heart disease, diabetes, accidents, and then chronic lower respiratory infections. The main political system since about 1877 is Democrats, and that's about that.
So the culture, was a large part of the community. They were into jazz, annual carnival craze, Mardi Gras, and food. And their environmental was completely surrounded by water after the hurricane. The elevation 6 feet below the sea level, which also contributed to the devastation after the levees broke. It's a semi-tropical climate, and it's the lowest point in the state, and a thriving, I can't say that word, metropolis. The resources, so the pre-existing resources were the tornado recovery system, FEMA, fraud management services, transportation, cleanup and unemployment services, and services available at the time of Katrina. The CDC provided personnel for the public health assessment, disease surveillance, lab support, infection prevention and control, and they also provided technology to ensure delivery of messages to the victims and staff members.
living conditions, economic vulnerabilities, and existing social disparities in health contribute to the exacerbations of chronic health conditions. And because New Orleans is located below sea level, without a natural draining system, this put the city at a higher risk for flooding from the Mississippi River, rain, and coastal storms.
So our plan that we came up with, so we wanted to address the fact that the large African American population was impacted greatly by the devastating effects of the hurricane. Of the total population, 69%, the 23% living below poverty were impacted largely. So they had the biggest hit on that vulnerable population. They were left without housing, they were stranded, and they had no means of transportation. So that left them in a pretty bad spot. So our plan was going to focus on that vulnerable population and other vulnerable populations near or below the poverty line. They're the people that have no or the least amount of access. The health promotion, we'd start with health promotion, providing access to health with an emphasis on preventative care, making vulnerable populations more healthy before disasters strike in order to make them more resilient afterwards. Levels of prevention, so primary, we'd look at community outreach, education in low-income communities. Secondary prevention, we'd look at free or low-cost health screenings within the community, making that accessible for people with limited means of transportation. Tertiary, we'd look into providing access to medications within the community, again, making things accessible to them. Health clinics maybe within schools, where children could both be seen by a physician and be able to pick up medications that they need. We want to reduce, so our SMART goals here would be to reduce the number of uninsured community members by half by the year 2020. Secondly, we'd like to provide access to medications for children through school-based clinics in all elementary schools by 2020. And third, we'd like to double the number of community-based sliding scale cost clinics in low-income communities, again, by the year 2020.